Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning, everybody, and welcome to this weekend's CAN Health Hour. My name is Chidi Ifediama. I'm a dermatology doctor based in London, and I do some dermatology research in Manchester as well. Today, we have an exciting session led by Dr. Oge, who's a GP partner here in London and also an NHS clinical advisor on the vaccine program. And Oge, I'll let you take over from there.
Take over. Let's get going.
Oh, sorry. I should say, welcome to everyone from YouTube, Zoom, LinkedIn, and Facebook. And if you guys want to ask questions, please just enter in the group chat on all platforms. Ask us questions, raise hands up, and we'll hopefully address all those questions as we go through the session. Sorry, okay.
No problem. Thank you. It is wonderful to be back on CAN Health Hour. I love this initiative. Let me try and share my screen. So hopefully this will work. And you can see the slides properly. Does that look okay?
Perfect.
Yeah, that's fine. Great. So I was asked to talk on this very important topic. So self-doctor, self-pharmacist, the dangers of self-medication and drug abuse. So my name is Oge. I'm a partner and trainer, LMC chair. I'm also welfare secretary with MANSAG, Medical Associations for Nigerians in the UK. And I've been a clinical advisor with the vaccination program down in the London region, NHS England. So really happy to be here with you on this, a bit grey here in London, Saturday morning. And I've got my warm jumper to help myself self-care. So just trying to move to the next slide. So Dr. Google, and it's not just Google, it's TikTok, it's Instagram, it's our social media feed, it's our reels. Every day it tells me something about my health that I didn't know, apparently. So I always say Dr. Google is not necessarily a bad thing. I always think it's really important that patients come with some knowledge about what's bothering them and equipped with what research they may have done. But I always say that consultation, that medical consultation, is a meeting of two experts. It's supposed to be a collaboration. You are the expert in your life, your body, what suits you, what doesn't suit you. So it's really important that you recognize it's a partnership. It's no longer we're just telling you something and you do it. The idea is you are partnering together with us to reach the best outcome. So you're the expert in your life, your body, what works for you, what doesn't work. And we are the medical experts. So that consultation is supposed to be a meeting of two experts. We value your contribution about what you're worried about, what you think may have gone wrong, what has happened before, what hasn't worked before. But it's really important that that is married up with an expert that has the medical expertise, that you have trust in them as well, that they're doing what they can to help solve your problem. So this is really the meat of it, the dangers of self-medication. It's not just about popping a couple of paracetamol from the chemist or that vitamin supplement you may have got from a friend. These are some of the real dangers, and this is what we want to highlight this morning. So how can you be sure what you are treating? So misdiagnosis, you're taking the incorrect treatment for something. There's something called the placebo effect. You take something, you feel better, you think, oh, it's fixed, but it isn't really. So how do you know what you're treating? We always start with a proper consultation. We'll start with a history. We'll talk about what's going on. We'll examine you, physical examination. We'll send you for some targeted investigations, and then we should come up with a shared management plan. So we need to know what it is we're treating to be sure we're targeting the right thing. If you start taking a treatment that you got online or from a friend, are you actually taking the correct treatment? Is it working in the way it should be? So I always say about do your due diligence, check yourself on a regular basis. You're the one with your body every day, even the best doctors can't be with you all the time. So keep monitoring and checking yourself. Whatever you're taking, is it having the desired effect? The other big danger, though, of self-medication and not getting a proper evaluation is that you can potentially mask other issues. So you can cover up what is really going on. You can mask things that mean that we need to act quickly. So that's another big danger that we want to highlight. If you're self-medicating or buying something over the counter or something you ordered online, are you taking too little or are you taking too much? So there's a range of plethora of things out there. Is it actually having, some of them may have a bit of an active ingredient in it that does do something. But one, are you treating the right thing? And are you taking enough of a dose, a therapeutic dose? Are you overdosing? So we all know the risks of overdose, and significant harm can be fateful if you're taking too much. We always say too much, even of a good thing, is too much. And then when we're getting antibiotics from abroad, you can't get them over the counter here, but then maybe you had that box in the cupboards or your friends didn't finish their course. There's a massive problem with antibiotic resistance. So if we're taking half courses or not the right course for the infection, huge risk of resistance. And that means when you do get an infection, we don't have enough antibiotics to treat you. Very, very dangerous. Are you risking major drug interactions? So you can either be interacting with each other if you're taking a whole cocktail of different things. How do we know what's working with what? We all need our working liver and kidneys to metabolize most medication. So is it affecting those organs? There's certain prescribed medication. Me as your GP, I'll be asking you to come in once a year or twice a year to get blood tests and monitoring. That's for the safe monitoring of certain medications and conditions. So is medication you're taking yourself that we don't know about interacting with prescribed medication? So I'd always say, this is where your consultation should be a place of no judgment and should be a safe place for you to open up with your real concerns. So if you are taking a supplement or you are taking something you got online or over the counter, please always let your clinician know when they're asking you about if you're taking any medication. We don't just mean the prescribed medication you get from a doctor or your pharmacist. We also mean stuff you may be taking yourself. It should be a safe, non-judgmental zone so we can openly talk about what you're worried about, what you're taking something for, and then come up with a solution jointly. And again, are you risking dependency? So dependency, drug addiction is real, and it can happen with over-the-counter medication you're buying. If you're ordering stuff online, you can never be sure of what's inside it. So are there ingredients that have the potential for addiction? Obviously, we're in a capitalist society. People want you to keep buying something. So if they can get you hooked on something, they may try. There's lots of things that are illegal, but you don't know what you're ordering when you order something online. You don't know what really the ingredients are, if it's gone through all the safety checks. We're very blessed in the UK. We have very, very strict regulation for the food and drug, well, the drug industry, for medications we can prescribe and you can buy over the counter. Companies have to be very, very careful about what they're putting in it and making sure it's safe and it's regularly monitored. But we don't know that for things that you order online from various companies. So we need to be very careful about that. So, ongoing with the dangers of self medication, is it not expensive? There's a lot of exploitation out there, and they feed off people's genuine concerns about their health, genuine concerns, anxious about health and symptoms. So they feed off that. There's social media campaigns promising everything, cure to everything. There is no panacea for anything. Life is not that simple. We know this. But when you are really worried about something, these campaigns know how to feed off our emotions and get us to put our hands in our pocket because we really want something to be better. And so I always say, go back to the basics of what is the problem you're trying to solve and what are all the resources out there for you to help you get the solution you need and keep you well. So I'm from Nigeria originally, and tonic. I hear this a lot from relatives and from people back home. I just need some tonic. I just want to be stronger and I just want to boost my appetite. So you will get them all these tonics. A lot of them may have vitamin supplements. A lot of them have various ingredients that aren't identifiable. But the key thing for me is, why is someone feeling weak? Why are they feeling tired? Why is their appetite reduced? Are there any red flags? What is the reason? So it's not just about the symptom. You come with the symptom, and that's what I mean with the meeting of the two experts. You come with what's troubling you and the impact on your day-to-day life. I can try to pattern recognize, look out for some red flag symptoms, and put something together in terms of examination, then investigations, to rule out some serious causes of what you're feeling. Not everything has a serious cause, but it's important we have these conversations early. The issue is, you take tonic, you may feel a bit better, but it may be masking some really more severe underlying symptoms and conditions. So some of the tips of how you can best protect yourself and your family. We are in the UK. We have the NHS here, So I know that there are long waiting lists and people struggle to get appointments with their GPs, but we are truly here to help you. We want to be here for you when you need us. And that's what a lot of us are doing and working with our teams. So I'd really encourage all of you, build that relationship with your local healthcare teams. We're wider than just the GP. We've got our practice nurses, the wider practice team that includes physiotherapists, mental health workers, care coordinators, lots of people out there. We also have pharmacists in the practice team, and we have pharmacists outside in the community. So build a relationship. Organizations like this encourage community peer educators. That's what we're doing this morning. But you have your friends, your social network, educate yourself so you can educate each other with the correct information. I always say to engage, question, contribute, ask for advice, be open and honest about your concerns, and make suggestions. Every GP practice has a patient participation group. We don't have enough diversity in those groups. Really connect and tell them what your issues are. If they're not hearing you, keep telling them and tell different people in that healthcare community where you live. I always talk about self-care. So self-care is important. It is important to self-care. So self-medication is different, but self-care is incredibly important. And each phase of our life brings different needs. So I always say, go for your screening. Prevention is better than cure. So your breast cancer screening, your bowel cancer screening, and your colorectal, the kits they send to your house screening. Those are really important. If you're worried about any symptoms, men, especially our Black men, go and talk about your prostate with your doctor. Get vaccinated. We're in winter, flu, COVID. If you're over 75, respiratory syncytial virus, RSV, let's try and prevent what we can prevent, or prevent serious illness for some of the stuff that's already circulated. You may hear from my voice, I have a bit of a cold myself at the moment, but know what's normal for you so that you can then highlight when things have changed. Encourage and educate your peers. We've already talked a bit about that, and direct them to accurate sources of information. Eating well, food first, all the colors of the rainbow. Aim for those portions of fruit and vegetables a day, and stay well hydrated with water. And warm water in this weather is always better, some people prefer. Move a little bit each day. So there's no point going for massive targets, 10,000, maybe reduce down. If you only do 1,000, aim for 1,050, 1,500. If you only do 2,000, aim for 3,000. So walking is enough walking each day, but being consistent and building strength and muscle is important. Make sure you are talking to good support systems, have support structures in place, counseling, and the importance of faith as well. And be part of a community. That's why I love this Khan Health Hour. Be part of something bigger, than work, family, money, worrying about bills. What makes you a whole person? I will say, in terms of self-care and self-medication, we all need to be on vitamin D, especially in these dark winter months. So most of us are deficient in vitamin D, even more so those of us with darker skin. So if you are feeling very tired and you're worried, your doctor can do a blood test. Because if you're very low, we'll give you a high dose supplement on prescription. But then after you finish that prescription, maintain levels with an over the counter supplement. So this is the main supplement we usually advise, because we know you need sunlight for vitamin D. And we're in England, we're in the UK. We don't get enough sunlight here, especially between September, October, March, April. So definitely take a vitamin D supplement. I usually advise 1,000 units a day to maintain levels. That's if your levels are not very, very low. And just some general winter well tips. I know it can be difficult to navigate this NHS. So if you are worried about your health or your family's health, instead of self-medicating, contact the NHS. We are here to help. And part of this forum is to equip and let you know what ways to navigate the system. So stay warm. We know that there are issues with bills, but contact your local authorities if you're struggling with fuel and heating bills. Staying active, we've talked about that. Be careful in slippery roads when it gets more frosty. Look after your long-term conditions. So if you know you have high blood pressure, diabetes, go and get your regular checks with your GP or your pharmacist. Don't delay treating some of those minor, excuse me, like I have a minor cold. I've been on my throat lozenges. Ask your local pharmacist and look after your mental well-being. There is something about SAD, seasonal affective disorder. So we look for things to help us be better. So make sure you're looking after your mental health as well. In terms of navigating the NHS, choose the right care at the right time for you. So self-care is important. We always recommend having a medicines cabinet at home, locked away from children. Simple first aid kits. Mine just has some plasters, some simple dressings. Have some paracetamol, small supply of paracetamol, ibuprofen if you don't have any side effects with anti-inflammatories, throat lozenges. I've been using mine this week. And these are all the different places you can go. So self-care, your community pharmacist, 111, you can call. They're also available online. Going to your GP. Most GP have online consultation as well as calling for an advice. Walk-in centers for minor injuries, and A&E and 999. So if self-care is not working or your symptoms are persistent, don't ignore it. Come and seek help. NHS website is actually really informative. There's a lot of information on there. So please go on there, engage with it. I encourage everyone, everything is moving towards this NHS app. And I know people are like, oh no, they don't like these technology modern things, but if we don't engage with it, they're expanding what you can see. You can see your health records. You can engage. I had a patient come and say, no, none of this is right, in terms of their problem list. And then you go through it. And it's important because you know about yourself and your life. The records tell a story, but you need to now engage with checking what it's saying about you and making sure it's accurate and working for you. So I'll encourage everyone to engage with downloading the NHS app. If you have hospital appointments, it's going to appear on there. So it's really important to stay plugged in and aware of what is going on with your healthcare. Wanted to just highlight, instead of self-care and you're struggling to get a GP appointment, we have these new initiatives that were launched earlier at the beginning of this year. So it's called Pharmacy First. So there were minor ailment schemes all around the country. So you can go to your community pharmacy for lots of treatment and advice on a whole list of minor ailments. Some of them are listed in the poster there. But now they expanded it to include 7 common conditions that usually you need to go to your GP to get a prescription for medication you may need. Now you can go to a lot of community pharmacists directly. So it's another way to try to increase capacity and increase access. So ask your local pharmacy if they offer these services and find out more about that instead of self-treating. That was all I wanted to say, basically. So I am open to any questions, and thank you for listening, as always.
Amazing. Okay, that was really informative, and some of those points hit home to me as well. Especially as a dermatology doctor, vitamin D is something that we advocate for. It's a miracle vitamin, basically, and does some wonderful things. Especially those and then those resources that we can now use, such as the NHS website and the Pharmacy First. For me, I think that they're such reliable and easily accessible resources that can often make patients a little bit more comfortable, whilst they often get the extra need for, if the need for the advice from the GP or from any other centres as well. So before I get to everyone else's questions, before I get to everyone else's questions, I have one of my own, which is, when we go see a GP or go see a healthcare professional, do you have any strategies to make sure that we, as patients, provide you with enough information to give you the best way to deliver the best care you can?
No, absolutely. One of my personal bugbears, that 10-minute block. People do not fit into 10-minute blocks. It's not enough time usually to address what's needed, but there are ways to try and make it more efficient. So that's why I don't mind. I had that tongue-in-cheek image about don't confuse your Google search with my medical qualification. But actually, patients that come equipped, aware of what they're worried about, and can format it in a way, can make the time go much more efficiently. So things like writing things down, people worry that they have a long list and we're like, oh my God, what is all that information? But it can help us focus, because very quickly, like I said, the meeting of 2 experts, I can sometimes go through the list and be like, okay, we have time. We should be considering this one, let's make another time, or you can go to this resource. So actually writing things down, putting it on your phone notes is a really good way of then distilling what the key things you can talk about at that consultation is. Thinking through patterns, like what brings something on, what has made it better, what makes it worse, that can help. And also thinking through if it's happened before and what's happened. Because like I said, you're the expert in your life. You know what's worked for you. If it's completely new and you don't know, then that's fine. Always really helpful to have an awareness of family history. Not everyone knows that, and that's okay. Tell us that. But if you are aware, maybe ask family members about things beforehand. But those are some of the general tips.
Amazing. Thank you. That's really useful. That's really, really useful. So we have Caroline, who's got a hand raised up on the chat. So Caroline, why don't you go ahead and ask your question?
Oh, okay. Can you hear me? Because it wasn't allowing me to unmute.
Yes.
Yeah.
Can hear you.
So the question really is it possible that doctors kind of overprescribe medications? Because what I find is doctors are more interested in us coming in, telling them what it is, giving us medication and fobbing us off and letting us go about our business, rather than actually saying to ourselves, why is that person feeling that way? A bit like what you said, we can mask ourselves with self-medication and we feel better for a while, but it's masking the problem. I'm more interested in, why am I getting this? and not give me a medication that you think, because really when you see a GP, she's thinking based on, and depending on how well versed your GP is, he or she is giving you her definition of what is wrong with you. In terms of what I say, or when I go in and I say I feel blah blah blah. But there's a lot of diseases that are quite similar. So how do I know my GP is giving me the best thing? I could go through all the medication under the sun and not be what it is. I just want a GP when I get in, I say to them, I've got this, that. Just take me to a specialist, let them do tests. For me, test is much better than trying to fob me off with many medications. And if it don't work, then you put me through tests, which takes too long, in my opinion.
So there's a lot there, and thank you for the question. Totally agree with you. I hate the treadmill aspect of healthcare. I think we have sacrificed more and more appointments on this altar of access, and we've sacrificed quality in terms of taking time to really understand what the patient in front of us is saying. But because of the pressures, we just want to offer more and more appointments, which is why people feel fobbed up and not listened to, and that can lead to more problems in the long run. So I completely agree with you. The answer is not more referrals to specialists, though, because if you think about it, specialists deal with one bit. You actually need generalists, your general practitioners, who are experts in a bit of everything and who can try and put together a picture. But that does need time and curiosity and mutual respect and trust, and that takes time. And it may be, medicine is a funny thing. People do not fit into neat boxes, so you're very right. You can have a symptom that may be underlying, it can have several causes, and it's a bit of a detective investigation job to unpick what's the most likely cause. And sometimes medication may be given to see maybe it helps, and in that might be a way to reach the diagnosis. But I always say, the thing we were taught as when we were training, and I teach my trainees, is GP, we have the benefit of time. So we can book follow-up. You are close to us. We're close to your homes. So the idea is, even though there's demands on system, if something isn't working for you, you're doing that due diligence. You hopefully have a follow-up where we then recheck things and send for the relevant investigations. I'm not a believer in giving something in the hope it goes away and not digging for the root cause. Medicine is not simple. We don't always have an answer for everything. And sometimes our job is to rule out it's not the big serious cancer or heart attack or stroke. But then we can't always tell you the reason for your symptoms. And we may suggest an intervention and then monitor it over time. So totally agree with you. Don't want people to feel fobbed off. I'm sorry that you felt that way with your GPs. It is an indication of the pressure the system's under. But you are the expert in your life, and keep being persistent. If things are still bothering you, then go back for that follow-up, even if you feel like you are bothering and things. I like the online consultations because it's another way to actually state all the things that are worrying you, because you can free text in a lot of those boxes. I know they make you follow protocols, but a lot of them allow you an option to free text. So then usually a clinician will triage that and then can book a follow-up appointment or telephone to discuss through. But then we've seen your concerns ahead and can think through and then look at previous what's happened and then hopefully put a picture together. But I agree with you. Polypharmacy, you also touched on that. I didn't have time to go into that because that's a whole topic of itself in terms of prescribed medication. And polypharmacy is when we're given, I don't know if the technical term is more than 5 prescribed meds or more than 10. I have patients on so many, and it's a big thing of deprescribing is important. And that's what I mean about that regular checks of that chronic condition. We do a lot of prescriptions. I have 350 sitting in my inbox right now, ready to sign off. There's a lot of repeat prescriptions that go out from GPs each week. A lot of patients, when I go on home visits, they've stacked these boxes neatly in their cupboards, and they don't want to embarrass me and tell me, they don't want to let the doctor down. And that's what I mean about those open, honest conversations. If a medication is not working for you, please tell us. That is, I don't want to keep signing that prescription each month if it's doing nothing for you or causing unacceptable side effects.
Mm-hmm.
Then we're supposed to have a conversation, deprescribe, and figure out another option, which may not be medication at all. So really important, like I said, to encourage those ongoing conversations, because poly-prescribed pharmacy is an issue, and then polypharmacy of people self-treating because they feel they can't get the access or they don't think their GP is taking them seriously is another major issue. So definitely
I
we
agree.
need to find solutions.
I was just going to just say a little bit about that. The problem is, as you're saying, you don't have the time. You're never ever going to be able to really help me as a person because you've got 10,000 people waiting for your attention. When I go in into a GP, I feel his tension. I feel by the time I put my bottom down, he wants me out because the next person's got to come in. And if you're treating a patient and they're already tense because you're tense, it's never going to work. So what you're saying, ideally, that's how it should work. And it sounds lovely, or maybe you're doing it, but certainly most GPs, when one goes in, and I feel as though sometimes GPs think that, visiting them is a pleasure for us. I really feel as though they think we want to be there. No, I don't want to be there, but I can't help it if I'm sick. And I would rather not be there. But I get this kind of, for me, a tag between the patient and the doctor, feeling as though it's a privilege that I'm there. And I don't want to keep on coming either, because this follow-up business as well, some of us have to work. So if you're telling me I can only come with one problem, but I've got systemic problems, how do I do that then? We need to resolve the whole issue. I get that GPs are under pressure. And as a healthcare assistant, when I was doing it, I was under pressure. But one thing I try and do is that I don't go into a patient with I know I've got another 10 people that I've got to see. If I'm seeing that patient, I'm concentrating on that patient.
At the person. No, listen, I completely agree with what you're saying. For me, it's really important the person in front of me deserves my undivided attention for that time I have. Nothing is perfect with the system, but what I can encourage you to, the idea is not to self-treat and mask and then avoid engaging with the health service. Absolutely. It isn't, there is pressures, there's no doubt about it. But if you're not happy with the person is giving you that care that you need, then there are other options in terms of registering elsewhere. And I always encourage people to go on the NHS website and look at the other options in terms of other practices. It's a bit of a bind in terms of admin to change, but it's possible. It really is possible. And you will find clinicians out there that are doing their best to treat the person in front of them and do what they can.
Okay, thank you.
Thanks, Oge. That's really good. And Caroline, I'm sure your points have been affected by other people as well. So it's really good that, being aware of the resources you can go to and how to really engage with all the facilities that are available to us. For all healthcare professionals, it's that relationship between the healthcare within the healthcare professional, the healthcare provider, and the patient, and that symbiosis is so vital.
Thank you.
Right, to move on to the other group questions from the socials. So remember, guys, if you're on LinkedIn, YouTube, Facebook, you're on Zoom as well, and any of the platforms that we're casting on, please do ask those questions, because
social media can be very good, and this is one of the great uses of social media. Absolutely.
Okay, so I'm going to kind of group some questions together because I think some of them are quite similar. So we have a question about what are your thoughts about online pharmacies, particularly the ability to manipulate the system to get the medication you want.
Really common. You all know the list. So a lot of them do their best to engage and inform. It's good medical practice to inform the GP record. So most GPs are the main holders of the whole record. If you go to different hospitals, they'll send letters to us. So a lot of these online pharmacists will send information to us. I'm sure you can all guess the main thing that's coming through my inbox from online private pharmacists: weight loss injections at the moment. There is no panacea. Believe you me, you need to do the work as well. So they will now write to us, and they are, I would say it's what you give them, so they can't do a holistic assessment. basically, because they don't have your whole records.
Yeah.
It's what you're telling them that they then go off. So of course they talk to you. Some of them I know ask for pictures and things, and they try their best to give it and issue it safely, but it's the information you give them. Some online pharmacists and people use to order regular medication and get them delivered to them, and it's a much more convenient way. So completely fine. But there are others that, yes, you can, whatever you put in, we always say rubbish in, rubbish out. So whatever you put in, then they will then give you the medication and information accordingly. So proceed with caution, I would say. But some of them do a very good service.
Amazing, yeah. So I think that's it. So being honest from the get-go means that you'll be safe. Hopefully, you'll be safe first, should we say?
Absolutely.
I know that we talked a little bit about vitamin D pills, vitamin D supplementation. I have my own opinion about this.
You're a dermatologist. You may know a bit more. But what particular type? Yeah, maybe you know.
But one question is, vitamin D pills enough, or should it be liquid vitamin D? I think someone asked another question about vitamin D as well, but generally, or is there specific vitamin D that you should take?
Specific brand. So I know it's D3. That is what we recommend. There's loads of stuff on my feed about K2. Take it with K2. I have no idea what that's about. Sorry for anyone that knows more. You may be able to say a bit more. But D3 is, I know it's enough. And I know the patients I've given it to, who the high dose, have really responded to that. And then for me, it's important to keep that maintenance going. So I just get a brand, find a capsule that's easy to take. So I take one that I find easy to swallow. And then I'm more likely to take it on a regular basis that way.
Yeah, no, I completely agree. I think it's definitely about the D3 is what we generally recommend as well. And it's how you prefer taking it, whether it's oral, whether it's tablets or solutions. If you're taking it regularly, then that's the main thing.
Yeah.
Okay. So we talk. So there's a question about the 2 months to get medication from the GP and appointments. But I think you've mentioned a lot about using the online services where it's possible, and speaking to pharmacists, because often that's a good way to ensure your medications are prescribed when they're needed.
Yes. What was the question about medication reviews, or what?
Well, the question particularly, I'll read out completely. It says, "I've been waiting 2 months to get medication from my GP. Appointments are hard to book, and when I finally get one, they send me for more tests. Even a simple blood test takes 2 to 3 weeks. I feel like I'm getting worse for something treatable. Wouldn't it be easy to travel to another country and buy what I need over the counter?"
No, because I'd say you don't know for sure what you need. And if they're sending you for more tests, then maybe they're worried and they don't have an answer to what they don't have a reason for what is bothering you. And like I said, medicine is not easy. Symptoms don't always fit into neat boxes. We don't always get the diagnosis with the first investigation. So it's to keep thinking. But if you feel like things are taking too long, that's why we use eConsult in my practice, but there are things called patches or Accurix, or they're different versions all around the country. And most of them have an opportunity for you to free text what it is you're concerned about. So I always say it's like not quite a love letter, but it is. I quite like that idea of you have time to sit down and think about what you want to say, not the pressure of an appointment. You know, there's a full waiting room outside, and you write down all your concerns. Believe you me, clinicians hate that morning rush and hate the fact that we don't have time. There's a moral injury being caused with a lot of clinicians, which is why we're losing great clinicians. We want to be able to, we came into this to help people, and we want to give people the time that's deserved. And always, because of the demands, the right people don't always get through, which is why, for me, forums like this, where we can discuss how to navigate in the different ways to get access to healthcare, is crucial. So if you're worried that you've not got a medication and you feel there's something you need, write that through to your GP. Maybe they, for whatever reason, they're not understanding that. Maybe they feel you don't need it. So then again, it's that open, honest conversation.
Great, thank you. So another question from here is, in fact, I'll bring it back to one point you mentioned. You mentioned about this whole group community, talking to family, talking to patient support groups and community groups. Now, I wonder whether you think these may be beneficial for this question in particular. The question is, are there alternatives to self-medication for stress or anxiety?
Yes. So definitely there are over-the-counter supplements that will say that will help, but it's never one thing. It's usually a cocktail of different techniques and strategies. So with stress and anxiety, and we know chronic stress is a silent killer, we all have to be radically intentional. I think I said this in the stroke talk, and I've been using it over and over. We all have to be radically intentional about self-care and what that means for us, what self-soothing looks like, what reducing stress looks like, recognizing if we're more anxious about something. So there is talking therapies. The NHS offers talking therapies that you can self-refer, most areas too. Most areas have someone called a social prescriber that's aware of some of the community groups that may be there, peer support groups that may address specific concerns, and they can signpost you to that. I'm always a big fan of the peer-to-peer teaching and advocacy and that coaching from someone who has walked the walk. So that's where those support groups can be really helpful. But with stress and anxiety, there's a plethora of stuff. It's not just medication can be very helpful. Self-medication over the counter may not have enough to really treat if you need medication, hence why it's important to talk to a clinician. Talking therapy, but we know things like exercise, eating well, talking to people you trust are important, but you need the impetus to get to the door to put those solutions in place, which is why there's sometimes a place for medication, but you need a thorough assessment. And that's why I always say to address those concerns with your clinician.
Great. I completely agree with what you're saying there. So there's another question that kind of falls or leads upon from that, which is ashwagandha.
Ashwagandha.
Yeah.
Okay, maybe I shouldn't admit this, but yeah, no, actually, there's lots to be said about alternative medicine. And fundamentally, for me as a UK trained GP, I have not been schooled in any of that. So I don't know. I am as much in the dark as you. So I wouldn't be able to advise you specifically. Some people go to naturopaths or alternative medicine physicians to look at those things. I'll always say, what is serving you? Does it work for you? You know, are you doing the other things? Because they'll talk about eating well, exercising, being out in nature, all those things too. It's never about taking a supplement alone. It is always married with that overall holistic help. So I'm not against it at all. I just think be open about what you're taking. Make sure you're sourcing it as good quality as possible, and then track, monitor. Sometimes these things take a few months to work or not work. Has it made a difference? Is it way too expensive? You know, is it doing what you're hoping it will do? Are you making sure you're not masking anything else? So it's not one or the other. Conventional medicine can work alongside alternative medicine completely, but it is really important to be honest about what the issue is, the problem you're trying to solve, and some of the techniques to potentially solve it. I know some people have done very well with some of those supplements. Ashwa,
Gandha.
I can never say it. I think it's supposed to reduce stress and worry and things.
Exactly.
And some people get along brilliantly with it. So is it helping you do what you want to achieve and accomplish? Is it helping you navigate life better? Is it not causing lots of side effects? Because some of these supplements, they'll add lots of things that can affect liver, kidneys, can interact with other medications you may need for your blood pressure or diabetes. So that's why I always recommend being open with what you're taking.
Yeah, exactly. I think that's it. So, like, you know, we're always learning as clinicians, and you know, we practice evidence-based medicine, but some things are new to us. And probably haven't been studied in the same kind of format that we're used to. So, patient information, patient experiences are equally valid, and that's something that we do value as well. Now, again, another on the theme of self-medication. I don't know if there's an answer to this one, but I'll pass it on to you anyway. What is one main drug we should stay away from when using to self-medicate?
I don't know. There is a main drug, is there?
I don't think
I
so.
think it could be anything. Like, what's in that tonic you got from, the Caribbean or the West African pharmacists in Nigeria? What they do, they'll put medication in these sachets. No box, no leaflets. Like, what is it? You know,
Exactly.
what is that tablet? What is inside it? So I wouldn't say there's one. The one real big danger we have in terms of, it's not really self-medication, it's more cosmetics. You know, the lightening creams, I would say, is always a massive, massive no-no for lots of different reasons. But then there's some that are proponents to treat eczema, but they actually have massive doses of steroids in them, which has side effects. You know more about that as well.
Yeah.
That's a common one in terms of, it's not just about tablets. It may be stuff you put on your skin that can cause damage. So there isn't one, but just, I would say, really think about what you're trying to solve and make sure you're getting a proper assessment if you need to, and especially if things aren't getting better, always do that constant due diligence.
Yeah, and definitely make sure you know where you're getting it from.
Yeah.
And it's regulated in some way or shape. Okay, so I think I'm just going to quickly scroll down, see whether there's any other questions.
There was just one in the chat here about the dose of vitamin D, 40 UG. So I had to look this up. 25 UG is 1,000 international units.
Okay.
So that's okay for maintenance. Some people take 2,000 a day, which is 50. So the 40 is probably about, I don't know, someone do the maths quickly. So that's probably a reasonable dose. I'd say 1,000 to 2,000 daily for maintenance in the winter months is probably a good dose. You can overdose. You can get to toxic levels of vitamin D. Quite hard to do that. You need to be taking the very 20,000 units a day, every day, for months on end, I would say. So if you're taking 1,000, 2,000 a day, you wouldn't be overdosing. Most of the combination calcium vitamin D tablets, I don't think have enough vitamin D, and not everyone needs calcium. We actually get enough calcium from our diet if you have a well-balanced diet. So it's important to look at that. That's a common medication that's prescribed that we try to deprescribe if not needed.
Brilliant, amazing, thank you. Okay, so I can't see any more questions. I think Leslie used to ask a question about vitamin D paired with K2. I think we touched upon that earlier on.
Yeah,
we're not too sure on the answer.
On K2, I just say if you take D3 by itself, you're not going to get the calcium. A lot of vitamin D comes together with calcium supplements. So I'd say D3 alone is mainly what's needed for supplements, not the calcium bit.
Okay, there's another question on what is the common drug? Is there a common drug that we abuse without knowing?
Yeah, so paracetamol. You can get codeine with paracetamol, low dose codeine with paracetamol. That can abuse. Ibuprofen. So those simple ones. So even though I put that, you should have a small supply in your cupboard for if you have the odd headache or if you're feeling run down with cold flu symptoms. Taking it every single day is a problem unless you have a diagnosed condition for which you may get a prescription. Anti-inflammatories are a major issue. They can cause bleeding from your gut, heart problems, and kidney problems. And because you can get them over the counter quite easily, people think they're safe. They are in moderate, small quantities for a short period of time. They're not supposed to be tablets you take every day indefinitely. So I'd say those are the main ones I worry about people taking lots of.
So I think that actually touches upon what Gemma Cage has asked in the group chat as well. If it's safe to take paracetamol daily, and what would you say there?
So I'd say it depends what you're treating. Some people have severe osteoarthritis, pain, wear and tear of the knee or hip or other joints, or an inflammatory condition. So in that case, you're treating a condition, and then you may need that to get going and keep active and keep deterioration at bay. So I would say you should be talking to a doctor or clinician if you're needing to take pain relief every day. Because if there's a chronic condition, fine. If you're taking it self-care and you've not actually had a diagnosis of an issue, there's a problem. So for short, up to a week, fine. If you're needing it over and over and something is persistent, you should be seeking medical help.
Amazing. Okay, great. I think that's all the questions we have on the forum. I guess that was a great talk and presentation. You've provided some really great and informative answers, so thank you so much. For me, some of the main themes that you've highlighted there are open and honesty. So being able to record what you've taken, being honest about your own anxieties, about your own worries, and being open, being confident enough to share that with your healthcare professional, healthcare provider. and the use of communities, not only talking to your family, but talking to community groups. I know there's other resources such as NHS websites and Pharmacy First, which can often help you with those initial concerns and initial worries. Obviously, one thing is to be patient with that journey. Healthcare and health conditions do take a long time to often get to the answer turned off. So that journey between you, the patient, and the clinician, the GP, is important. So trust that. But if you're unhappy, go get second opinion, go get advice.
Yeah.
But doctors are there to learn from you, and we're happy to teach as well. Yeah. Okay, so with that in mind, okay, I'm going to thank you again.
Thank you for having me. Until next time, hopefully.
And thank you guys who've all been around from around the world. I know that Khan has now got its tentacles in different continents, which is incredible. So please stay engaged. I'm going to pass you on to Sam, who's going to give you some highlights about what's coming for the next few weeks and months. But yeah, thank you, and see you guys next week.
Hello, everyone. Thank you very much again, Dr. Oge and Trey. Really do appreciate you volunteering your time to help educate the community and improve our health literacy. I'm just going to go through these slides very quickly, guys. Just bear with me. So again, we're having Health Hour next week, same time, same place. We've got a very interesting topic. We're yet to announce it, but please look out for it on socials, and we'll hope to see you next week, same time, same place, and continue sharing this with your community, your friends, your family, and improving health knowledge wherever you go. So, it's the Christmas markets are popping up everywhere. That means, the season's here. It's time for Christmas, and we are going to be having a special Christmas carol service at the Manchester Cathedral. We're inviting you for this free event. It's on the 11th of December. Come down with your friends, family. We're going to be singing carols, going to have a great time. And yeah, it's going to be wonderful. It's from 7 p.m. And yeah, bring the Christmas spirit and come celebrate with us, because this year's been a fantastic year, and we want to end it with a great celebration of togetherness. If you're in Lambeth or if you're in London area, on the 23rd of November from 12 to 4 p.m, we're having a special event in Lambeth dedicated to reclaiming Black women and family health. This event will be special event focused on sexual health. There'll be free health checks there. There'll be consultants there ready to have a chat with you. And yeah, it's going to be come down. It's going to be a free event again for the community of those focusing on sexual health, but everyone's involved. Everyone is welcomed. Bring your friends, family, children are also welcome, because there's going to be activities for the children to be entertained and get to mingle with other people, and it should be fun. So we look forward to seeing you there. All the information will be on our socials. Please feel free to scan the QR codes as I go through this presentation, and also the information will also be in the chat by the help of my colleagues. If you're interested in arts or anything related to the greenery, the outside, the outdoors, painting, anything like that, please join us in our local hubs in Bolton and Stockport, where you can, get to learn how to crochet, how to knit. It's getting cold. You might need some gloves. You might need some hats. You might need some scarves. Hey, you don't need to go to the shop. Come down and learn how to do that firsthand with our special team there that's going to be training people. And if you want more information, please contact Lola at Green and Arts Wellbeing at con.org.uk. Again, this is for the people based in Gorton. This is a family hub. If you're a young family, or you've got young ones around and you want them to interact with other young people, or you want to build that sense of community that you feel like you may have missed out on, please come down to our hubs at Sacred Hearts. It's going to be every 1st and 3rd of the month. It's wonderful. There's going to be various events and various things going on during these hubs. Again, you can get health checks there, because again, health is priority to us as a community, and health is priority to us as Con. Visa transition, guys. I don't know if you know about this, but there's news out there that things are changing. So please come look at your knowledge, come be updated with what's going on, and come and make sure that you know how to be safe in the UK, because things are changing drastically, and you need to make sure that we don't get left behind. That's something that generally tends to happen with us as a community. So come down, scan this QR code, register for this event. It's on the 23rd, and it's at 1 p.m. It's going to be a quick session. You come get your information and make sure you stay safe and you don't get into any legal troubles. Again, we are trying to improve the life of our people as a community. The NHS has asked us as a community to get involved, share our voice, share the things that are important to us, and shape what the NHS is going to be in the future. So please, guys, scan this QR code, speak up, and let's help end health inequalities. If you're a woman living with diabetes and experiencing menopause, please, we would like to hear from you. Diabetes is something that affects the community greatly. So please get in touch with us. Contact this email address, r.black3@ulster.ac.uk. Get involved with this study. You would get a £15 remuneration voucher for taking part. And we want to hear your thoughts about this. We want to know what your experience is. And it's quite a unique experience because you are going through two things at the same time. So please, ladies, going through menopause and living with diabetes, please get in touch and share your story. Thank you very much today, guys, for tuning in Health Hour. It's been a wonderful session on drug abuse and the dangers of that and learning how to appropriately self-medicate. I think one of the big takeaways for me from today is I should continue taking my vitamin D and my K2. I take a lot of supplements, so those are one of the ones that I will never stop taking because it's actually improved my health since I started taking them about 2 years ago every day. So thank you very much for joining us, guys. It's been a wonderful session. We'll see you here next week. Feel free to share this session on YouTube because it's live right now. And feel free to invite your friends and family for next week. So have a wonderful Saturday, and we'll see you next time. Bye-bye.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our Health Hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.